Right now, it's 75 degrees Fahrenheit. Tonight, expect a low of 61 degrees. Would you also like to check the air quality?
Well, oh wow. Hot microphone. Scott was supposed to be here 40 minutes ago. No, not sure what's going on. If he doesn't get here in a minute, we'll get started. Sorry, everybody.
Mucous membrane, bro. 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 Mucous membrane, bro.
Hearken to thine inner voice and give thyself a bell. No task shalt be denied if thy will be strong and true. For when a bell is rung, it carries with it the sound of courage, that giveth strength to even the meekest of hearts. So ring thine own bell, and be mindful of its power and might, for 'twill be thy guide in whatever task thou setst thy sight. Hearken to thine inner voice and give thyself a bell.
Hello, he's coming. He's on his way.
Okay, you want to just come on up?
If you wanted to, yeah.
Sure, just leave the front door open for him.
Can you, like, shut up?
Mucous membrane, bro.
Can you, like, shut up?
Yeah, man. All right. You want to try your headphones? I got you the good ones. Hello, testing.
Hello.
Hello. Hey, Sean and Amanda. I don't know if you know this, but the Dabby Awards went live on Shuli's Patreon. Probably worth $5 for a month just to watch that. So, all right. And we're still waiting for Scott. Are we just going to start without him and then let him just come on in? I mean, he was the one that said,
Yeah.
you know. So I figure he got in the middle of something. All right. All right. I'm going to cut this thing off. Get rid of the white noise in the background. All right. You got your topics? Did you get those list of?
I didn't use those. I used the one you sent me the week before.
Okay. Fair enough. All right.
I have a back pile if I can find them.
Okay. Well, actually, I had the AI do that, which I thought was pretty cool.
Yeah, that's cool.
So I'm going to let you do that first because I've got a question from Mom Swipes Left podcast.
Okay.
And I'm going to do that with Scott here because it's something that he and I have both had to deal with. So we'll do Tacey's time of topics first. All right, let's do it.
Sirius XM. It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I beg you.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, who's not here yet. He is late.
Late.
But he is the traditional Chinese medicine provider, gives me street cred with the whack alternative medicine assholes, even if he isn't here. So, and then you hear the dulcet tones of my partner, Tacey.
What does that mean?
It means sweet.
Yes,
that
I'm
sweet
sure.
voice.
I'm sure. I hear that all the time about my
Not grating
voice.
in any way.
No, that's what I hear.
This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-76643. That's 347-POO-HEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, etc.
You know, I want you to think about my parents. And then think about my voice. And then think about how lucky I am to have it.
This is true.
Yeah.
Well, you see, without your parents, you wouldn't have any voice at all because you would not exist. But
I'm just saying, I'm lucky to have the
you
voice
got big Joe St.
that I've been given.
Yeah.
Considering.
Yes. Right. You've got your dad's vocal cords in a woman's body, and then you've got all 40.
You need to just stop right there.
42 years of conditioning of your mother.
Yes.
Okay, fair. All right. And the dumbass is ringing the doorbell. Now, here, let's see. Oh, someone's at the doorbell.
Someone is at the doorbell.
Okay. Can you just tell him to just come on up? I thought he knew that. Anyway. All right. Well, listen, Tace. We have just fucked up the beginning of the show. Hang on. All right. Jesus. I can't believe you just rang the doorbell.
Can you squeeze in? I don't know that you can, Scott. Here, let me get out
Can't
of the way.
get by them big old titties, that's for sure.
I don't know if the boss was down there or not. I think I better take that. Oh, sorry. I'm a little bigger than I should be.
Did you get caught up in some shit?
How's your, oh, and thanks, $1,000 microphone, dude. Jesus Christ. He didn't even see what he did he?
No.
It's all right.
It'll be all right.
Okay.
Lancing blow.
All right. Let's just, let me see where we were. Okay, I'll just stop right there. Okay, you ready? Is your mic on?
Check.
Okay.
Yep.
Are you ready?
Yep.
Because I'm just gonna.
I'm ready.
I'm just gonna say you showed you got here, and here's, well, shit, wrong. Okay, so I blame Scott on that. Okay, let me see. And look here, why is it still doing that?
I think you might have been called a dumbass.
Okay, here we go. And here, look at here. Here's Dr. Scott. Just made it into the studio. Hello, Dr. Scott.
Hey, Dr. Steve. Hey, Taste.
Hey.
All right. Check out Dr. Scott's website. It's simplyherbals.net. That's simplyherbals.net. And he has the absolute, not a commercial, best CBD saline nasal spray that has ever existed on the face of the earth, and I do mean that. I give Dr. Scott a lot of, the S word, but it's I'm not kidding on this situation. So, all right, very good, sir. You know what time it is, Tace?
All right.
Oh, no.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey. Hello, Tacey.
Hello, everyone. So I have an article about penile length, and is an increase in penile length a cause for concern?
Why would it be?
I have no idea.
So now male fertility has been declining over time. It's interesting that as male fertility is reported to be declining, it's really sperm count. That you have a story that shows over time male penis length has been increasing.
Mm-hmm.
So let's hear that.
Okay. Sperm quality and testosterone levels have decreased over the last few decades.
Okay. Well, very good. Okay.
And in a study published February 14th in the World Journal of Men's Health, they compiled 75 studies conducted between 1942 and 2021.
Okay. Of penis length?
They found, let me get to it.
Uh-oh.
Okay. Oh,
The
sorry.
average penile length of 55,761 men increased by 24%
Wow.
over 29 years.
Wow.
Could be due to environmental pollutants or an increase in sedentary lifestyles.
Both sound, it sounds great.
These could
Give
be
us more
causing...
pollutants. Oh, you know what it is, Scott? It's that damn DDT that we used to run.
There it
Well-
is. That's what did it for
Made
you.
our penis longer.
It's saying
believe
it could be causing reproductive related changes. Now, I've had wine, so just bear with me.
Okay.
Fine.
What were the motivations behind the study? You know, the sperm counts and testosterone levels have been declining, also increasing rates of male congenital birth defects.
I don't like that part.
No, heck
No, I don't either. Erect penile length is getting longer from an average of 4.8 to 6 inches in over the last 29 years. None of that, please, sir. Thank you.
Okay.
What are the health implications and factors at play?
Well, deeper penetration, I would assume, would
Well,
be one
no,
of them.
they're not going with this sex-wise,
Oh,
unfortunately.
really? Well, what
This
else is
wasn't
there?
from Penthouse. Could be chemical exposure, pesticides, or
Oh, I
hygiene
see.
products.
Pesticides. Okay, I'm going to do this for myself.
Give thyself a bell.
Chemical exposure has also been, I don't know this word,
Okay.
posited.
Posited. Yeah. In other words, they're flying that as an idea.
Okay, never heard that word before. For a cause for going into puberty earlier. So what do we need to look at next?
So if people are going into puberty earlier, they have
Yes.
more time to grow their penis. Maybe the time of puberty is longer.
See, if you were a woman, you would know people were going through puberty earlier because women are going through
That's
puberty
right. But
earlier.
guys are like hiding it.
Yeah.
I remember when I was in the shower and I had I had pubic hair and nobody else did. And I remember somebody saying, "Ooh, I almost said my name. Ooh, Steve, nice forest down there." And I was like, that's gee.
Oh, he
Number
peaked
one,
early.
Don't-
He peaked early.
Gross, yes. It's all
why are you
downhill after
looking?
that.
And number two, why are you commenting? Good Lord.
So we need
It's
to
a
take
good
a look.
icebreaker.
Yeah.
Fair.
Look at my hair, guys.
Yeah.
You need to take a look at the pediatric population and to ask if there are similar changes according to women's reproductive organs.
Interesting. So bigger clitorises, are you saying, or something like that, or bigger?
I meant
bigger
what I
meaty
said
vulva?
to ask if there are similar changes occurring to women's
Well,
reproductive organs.
Okay, that would be a similar change. Is bigger external genitalia.
They did not mention a clitoris anywhere in this article.
Okay. Thank you.
Thank you.
Do you have any other topics?
No.
Oh, this was Tacey's time of topic.
Yes.
So, when I remember thinking, when I was a kid, I went to a Boy Scout camp. And we had, oh, by the way, did you ever have a Kaibo at your camp?
No.
That's what we did. It was called the Kaibo, Kybo. It was keep your bowels open. And it was basically the latrine, right? And, but I remember that walking by and seeing one of the adult counselors taking showers with the other kids. And I thought, when I'm older, I'm going to have this big, giant penis that actually sticks out from my body, right? And the shower water will drip off of it, and
goodness.
No.
and then looking back on
goodness.
it, this counselor was in there with a big old heart on.
Oh, that's really terrible.
I know.
Strike
I know.
three.
Isn't that strange?
You ruined my topic. Time
Well, no, your
topics.
topic time is over. I'm just telling
you ruined
fun
it.
stories from my youth.
Dr. Stephen is
mean, how-
flashbacks.
right.
Oh, God.
Yeah, but
We're all going to be jaded from that story.
that guy's
my
stupid
God.
cock is
Oh,
burned in my
gross.
brain from when I was like 7, 8 years old.
Lord. Oh, man.
So I'm sure he was thinking about something else.
Yeah, what about... Gosh, what a great topic.
I gotta take this. Hang on just a second.
You got to have another topic.
That's all I got.
Sorry, buddy. I'm on hold. Hang on.
Schedule ahead at cbs.com/vaccines.
I don't know how to do this, though. Unbelievable. Fucking believable. Every time I deal with them, this happens.
You gonna try calling back in a minute?
No, and then you go into the back on the end of the queue. Okay, well, this will be a fun experiment. I just got a phone call, and I had to stop the show for just a second. And I have an emergency prescription that I have to send in to CVS. And been on hold now for how long? And
Too long.
Yeah,
Long
just gonna
time.
I have to talk to the pharmacist, and nobody is picking up. Now, have you ever been there to one of these pharmacies? And I'll have to bleep out the name of the pharmacy, but have you ever been to one of these and you hear doctor call on line 2, doctor call on line 2, and no one is paying any attention to it whatsoever. Anyway, so yeah, okay, well, good. You got good for you. So we have
It's a little too loud.
Oh, yeah. Hang on just a second. Hang on. Okay, well, moving on. I was on a show this week called Mom Swipes Left. And it's two women, Jen and Carol from Maine. And they have a somewhat fanatical audience. They've got this guy that's a potato like Cardiff. Matter of fact, that's where Cardiff got the potato from.
Okay.
But he's a potato underground. And he does an after show to their show called Palm Swipes After. And then Cardiff started doing the potato because he would do an after show to Palm's after show, because Palm is just French for potato. Mm-hmm. And he would do Palm Swipes After, Palm Swipes After. And then he kept the potato, and then the potato became Cardiff Electric. And now everybody thinks of him as the potato. But the truth is Palm Swipes After was first. But anyway, fanatical fan. And I had a lot of fun on their show because they asked a lot of weird medicine questions. I mean, stuff that we used to get way back in the day, back when this show was really weird medicine before COVID ruined it and it became a little bit more serious. And I've been wanting to kind of get back to doing more dicks and nuts and that kind of stuff. And it was basically an hour of those kinds of questions. So it was a blast. And they were really funny, and I think more people should probably be listening to them. At least listen to my episode, which will be up.
Which would be awesome.
Yeah, which it should be up by the time you hear this. But anyway, so I said, why don't we do a bit where you guys call in every week, or whenever you have a notion to, and call in a weird medicine question. And we'll plug your show, and it'd be good for everybody.
Cool.
So it's where did I put this thing? Okay, here it is. Here's their sweeper that I made this morning. It's very rudimentary, but it'll just have to do.
It's time for Mom Swipes Left Has Questions with Jen and Carol from the Mom Swipes Left podcast.
Hey, Dr. Steve.
Hey, Dr. Steve.
It's Jen and Carol from Mom Swipes Left. We have a question for you. How common is it for a man to ejaculate with a little bit of blood in it? Like, is that a terrifying thing?
Wait. Pause.
Yes.
What?
One time, someone in my life ejaculated and there was a little bit of blood in it. It was
That
pinkish.
is nasty.
Okay. Let's not shame. I'm wondering.
Yeah, let's not hematospermia shame. I wanted to wait for you to be here since you and I have common interest in this question.
How common that is, because I would imagine that if you get like smacked in the nuts or you move a wrong way, there's a lot of blood vessels in your nuts and stuff.
Are nuts that sensitive?
I think they might be. That's what I'm asking you, Dr. Steve. How common is it for that to happen? Because most men ejaculate into a mouth or an ass or a pussy.
Oh, right.
In that
you
order.
would never know.
Right.
Huh.
Thanks, Dr. Steve.
You're the best.
No, thank you. That's a great question. And Tacey, you know, God damn it, hang on. You got choked up because Jen and Carol. Hang on. Good Lord. We're never going to get through this.
Nope.
Okay. So, Tacey, you probably remember when this happened to me.
Nope.
Do you not?
No.
Wow. You really don't pay attention, do you? It's okay. We were in Jamaica, and we had.
Oh, I do.
Okay. Oh. Yeah. Now we were in Jamaica, and we had a session, if you know what I mean. And I noticed that there was some blood that was just sort of dripping into the turlet at the time. Mm-hmm. And that's when I ended up having to have the fiber optic scope.
Mm-hmm. Yes.
So it is called hematospermia. Dr. Scott's had it too. Is that why you had it? Did you have hematospermia? Why did you have the scope done?
Well, prostatitis.
Okay.
Yeah, just to rule out any kind of prostate or bladder cancer. Yeah, but I certainly probably had some of that too.
Yeah. The good news is that the condition is usually benign.
Yes.
You would think blood in the semen would be a sign of something bad. But you do have to exclude the bad things first.
Yep.
You do a physical exam, you do some laboratory eval, and then every once in a while you get the old fiber optic tube shoved up your urethra.
Sweet mother of pearl.
Now, what my friends are telling me who have had this more recently.
Uh-oh.
Uh-oh.
Amber alert.
Yep. Okay. In another city altogether, so I hope the kid is okay.
Heck yeah.
The urologists are a little bit better about doing these things than they were when you and I did it, because when you and I had it done by the same guy, and it might have just been him.
It might have been his technique, I'm thinking.
Yeah.
And his desire to inflict pain on us, I would agree, yes.
And he was a funny sort of guy that way. And he took numbing gel and put it on the end of this fiber optic tube. It was probably the size of maybe a cocktail straw.
I was thinking more like a small finger.
Oh, shit.
At least that's what it felt like.
It does feel that way.
Bells, Junior.
You have there's a whole lot of nerve endings in that part of the body.
Yes, that was not fun.
But it was, so, you got a cocktail straw sort of flexible fiber optic scope, and he put numbing gel on the end of it and then just jammed it in my urethra through my...
It takes 20 minutes for numbing gel to work.
Thank you.
Give myself a bell.
Son of a... How many am I down now?
That is correct. Well, I've got
you
one.
won
And
last
Casey's
time.
got one.
Yes, that's true. Damn it.
But yes, it does absolutely nothing.
Yeah.
It made them feel better.
Yeah.
Doesn't make us feel better. And to the point that I was in so much discomfort. Now, again, Scott and I have talked about this before, but we don't want to dissuade anyone from having this done.
No.
So it wasn't that bad, but it's fun to talk about how bad it was. But it was bad enough that when I left that place, I backed into somebody's car and I got out, and it was like I couldn't wait to get home because I felt like my urethra had razor blades, was lined with razor blades. And I got out of the car, looked real quick, no damage, took off home. And then about an hour later, I get a knock on the door. And it's this police officer saying, "Did you hit somebody in the parking lot?" It's like, yeah, but there wasn't any damage. Looking at that later, I think that somebody saw me hit the car, get out and look at the thing and then take off. And then they told the person whose car it was what my license plate was. And then they went, "Oh, yay, I can get this other light on the wrong side fixed by this guy's insurance company because it was there's no way in hell I could have hit that side of their car with my car."
No.
But anyway, but I digress. And then it was totally normal. So in men younger than 40 without risk factors, and the risk factors would be history of cancer, any sort of known problem of your urogenital system, or any bleeding disorders. And in men with no associated symptoms whatsoever, which was me, hematospermia is self-limited, requires no further evaluation. Every once in a while, they'll put you on an antibiotic just to make you feel like you're doing something. And, many cases are attributable to sexually transmitted infections, but that wasn't my case. So it was just one. It was one and done.
Right.
Well, I mean, Tacey's
I was playing.
Tacey's pretty clean.
Yes.
But anyway, so yeah. Now, if you have fever or chills or bone pain or anything like that, then you got to do something else. Yeah. And but yeah, it's not that common, but it ain't that uncommon
Not
either.
uncommon here. And to answer our other question, are the testicles sensitive? The answer would be yes.
Yes. Okay.
Yes,
well.
Yes. Just
Give
to
thyself a bell.
Oh, there you go.
Just to clear that up for if there's anybody.
Well, I think what she was saying is if you got kicked in the balls, would it make your sperm bleed? And the answer to that is most of the time not.
Most of the time, no.
Now, if you get kicked in the balls, it could give you epididymitis.
And that sucks.
That sucks.
Yeah.
That's why I had to stop bodybuilding because I started getting epididymitis, and every time I would lift and do the Valsalva maneuver,
Those 12-ounce curls were killing
Shit,
him, weren't
go
they?
fuck yourself. I'm taking a bell away.
Oh, no, don't debell me. Oh,
Stupid mind.
dang it.
Stupid.
Dang it.
No, dude, I used to go with this guy. His name was Gary Latta. He and I were both ham radio operators. He was in Durham, North Carolina. And we would compete against each other at the gym. And we got to where we were curling the max on the dang machine, dude, and that's when we had to go to free weights. So I've got that. Listen, I know you can't
got the
tell.
24-inch pythons like Hulk Hogan.
There's pictures of me holding my nieces up by my guns.
And they weighed 8 pounds each.
Exactly.
Okay, all right.
Okay, so we know there's no part of the story that, except for that could be true. 2 ham radio operators that lift weights, not a chance.
Okay,
one maybe, but not 2. They're just no way.
Oh, he
in the
deserves the
same
bell
in
for
the same
that.
city.
Yep,
Uh-oh,
lost
no
another
chance.
bell. Now you're
Dang
minus
it.
one.
Oh man, you can't go back to my last show. You can only take away from future shows.
Okay, fair. All right.
I won last show. Fair and
That was
square.
hilarious.
That is true, though. We were an anomaly.
Hey, but true now. But true, weightlifting can certainly cause bleeding down there.
Well, it certainly caused epididymitis for me. So, I just got this horrible pain like I'd been kicked in the balls.
Oh, it's awful.
Every time I went in and started lifting, so.
Awful.
There's this guy at the gym
I'm going to
today.
start lifting again just so I can prove it, because I should pump back up pretty quickly, given that it's only been 50 years since I did this.
Let me tell you about this guy at the gym today.
Okay. Yeah.
He was doing dead weights.
Yeah.
Way too much weight. He couldn't handle it.
Yeah.
Spitting everywhere in the middle of a pandemic.
Spitting?
Yeah, like.
Oh, you mean he was getting up there?
Yeah, spitting. And it was going nuts.
Oh, jeez.
So I probably have COVID now.
And this is a chain.
Oh, goodness sakes.
And this is a chain place. It's not some
No,
crappy
it's not
gym.
a chain. I don't think.
Oh, it isn't?
No.
Okay. Well, all right. I don't want to say the name.
No.
That's pretty gross. Listen, if you're going to deadlift and stuff, stay within your weight.
And don't spit everywhere.
And then you won't spit.
Yeah.
God, have you ever seen these monster dudes in the Olympics?
Oh, gosh.
It's amazing.
It's incredible. I love watching the strongest man in the universe contest where they carry those damn boulders and stuff.
Oh,
around.
yeah.
It's like, holy
or logs.
Or logs or whatever. Who cares? It's like,
cars.
I couldn't move one with a fork truck,
No, I know.
Holy
It's amazing. It's like those guys are different species from us.
Yeah, really.
All right. Here's a good one. Tacey, you've got some ability to answer this one.
Oh.
Hey, Dr. Steve and Dr. Scott, what's happening?
What's up?
Good to see you.
We'll say hi to Tacey.
Hey, I have a question for you.
Oh, well.
Not COVID related. How about that?
Oh, thank you.
good.
So I was wondering.
Give thyself a bell.
I have really bad GERD, and since they removed Zantac from the
Okay, when he says GERD, he means gastroesophageal reflux disease. Most of the time, it manifests as heartburn. So, okay.
shelves, or ranitidine,
Yep.
I haven't been able to find anything that works. Do you know if they're going to try to bring that back without the cancer? Or are they working on anything that you know of, that you've seen in your journals? Holla back. Hope you all are doing good. Thanks. Bye.
You want me to start?
Yeah, go.
I'll
please,
take the
please.
first step, and you take the medicine part. Yeah, first thing we always tell people is with GERD, any kind of heartburn. Start warm foods, warm drinks. You want the stomach to be warm so that the food moves through your stomach more quickly and less acid is produced in the stomach. So that will cut down a little bit. And that's number one. Number two, for acute cases, or if you have it occasionally, a little shot of mustard down the old hatch does help a little bit.
Which is crazy, but I can attest that he is not wrong about this.
Yep. It's not a cure, but it is.
Give thyself a bell.
Yes.
Giving them out.
I'm only negative one now.
Yeah.
Yes. Back to negative one.
You're at zero.
But so there are a couple things you can do. You can do to hopefully not have to take the medication, but sometimes you do have to take those medications. And,
yeah.
And
Well,
Dr. Steve, you got some of those.
Zantac was ranitidine.
Mm-hmm.
And in 2020, the FDA issued a recall of the over-the-counter versions of ranitidine, generic name of Zantac. And I'm going to keep saying that because there's a reason, and you'll see in a second. They were. It didn't matter what company produced it. and the FDA said that there was cancer risk on all the versions that were out on the shelf. So they come out with a new name, Zantac 360, and it's back on the shelves.
Oh, is it?
Yes, but
did not know that.
Zantac 360 is not ranitidine; it is famotidine.
Oh, Pepsi.
So it's this extremely deceptive in a way because famotidine is Pepsid. And did you just say that?
Yes.
Did you just say Pepsid? Okay.
Give thyself a...
Okay, there you go. So, good.
But he's taking H2 blockers when he could be taking an entirely different class of medication.
Hearken to thine inner voice and give thyself a bell.
Oh, another one.
Suck it.
She's on a roll, baby. She's
And
on a roll.
Why don't you
that
talk
is
about that for a minute?
By far more effective, and it's called a proton pump inhibitor.
Yes. Now, why is it that I'm going to pimp you on something about H2 blockers?
Okay.
Why is it that someone will take them and then they just find that they don't work anymore?
It just gets tachyphylaxis.
Hearken to thine inner voice and give thyself a bell.
Wow.
Dang it.
That is
today.
absolutely right. That's exactly
Hang
the
it
right
up,
answer.
baby. Hang it up.
Tachyphylaxis.
It only
which is-
blocks histamine, whereas a proton pump inhibitor blocks all three of
Okay,
the
I can't give you any more bells. You're absolutely
Yeah.
right.
She
belled out?
Tacey wins.
all three of
Yeah, I
the
I submit.
acid producers in the stomach.
Right. So,
So-
there are pumps. There are quantum devices because a naked proton is a quantum object that is consisting of 3 quarks, and it's 2 up and 1 down, or 2 down and 1 up. I can't remember. I used to know that cold, but it's a positively charged quantum object. Then those things are just basically waves in there. It's crazy that we have a device in our stomach that can take a quantum object before we even knew what the hell that was and move it from one place to the other the way it wants to do it.
Yeah.
And when you pump protons into the stomach, you drop the pH.
Right.
Okay. And so when you block those protons, you raise the pH and you decrease the amount of acid in the stomach.
Right.
And the thing about them is, and Scott is not a fan, and I'm kind of not either. I wish I didn't have to take them. But once you get on them, it is harder than hell to get off.
It
of
really
them.
is.
Yeah,
You
it
absolutely can't. But
And why is that so hard, Taste? There's a
because
phenomenon.
the relief is, I mean, they're just so effective.
Well, that's true. And also, when you stop taking it, you get the rebound effect. That.
Well,
Okay. Wait, all right. Now you know something about this. So tell me, is that a myth?
I mean, I can't really talk about that.
Well, you.
I mean, I'm not.
Is there data that shows that the rebound phenomenon is not a real thing? Because you can talk about that.
No, I can't.
Okay.
So
Okay.
I'm just saying.
Yeah. Go ahead. Don't be uncomfortable. Just say what you can say. It's fine. There's a reason why Tacey has to be careful.
Yeah, I do need to be careful, and I would say though, if you are taking any heartburn medication,
Yes.
at all,
Yes.
and it's not working for you, try taking it 30 to 45 minutes before you eat.
Okay.
Because you need to fire those pumps up. Smelling the food fires those pumps up. You get more pumps alive. That's more pumps you can kill when you take the medication.
Okay. Very interesting.
So that is a lot of times patients' medication would not work, and it's because they weren't taking it properly.
Right. Right.
And
the
that makes a big difference.
The other timing is everything with some drugs. Statins are that way. If you take a statin during the day, it won't do anything. Statins
Except
block.
for give you neuropathy.
Okay. Statins block an enzyme called HMG-CoA reductase, and you only produce that at night when you're not eating. It's when you don't eat that you produce that, and you want to block that to stop making cholesterol. And if you take it during the day, because you're eating all day, it doesn't work. So timing is very important.
Timing is everything.
Now,
And if he has not tried Nexium or Prevacid or
Protonics.
Protonics. Is it over the counter?
Yeah, pantoprazole. Yeah, there's an over-the-counter
I think so.
pantoprazole.
I haven't paid attention.
There's lansoprazole, pantoprazole, and omeprazole, and I don't know if esomeprazole is on the over-the-counter. Do you know? Yeah, I guess it is.
Nexium,
yeah,
yes.
Nexium.
Yes,
yeah,
it is.
Yeah. So,
but those doses are half the doses that were prescribed.
correct.
So, but you need to talk to your doctor before you take any of this stuff, because you're only supposed to take it for a shortened amount of time, and people get on these medications, and
keep going, Sister Priest.
They take them and they take them and they take them, and you can't get them off of it, and there could be something else going on.
Right. Yep.
So you need to talk to your doctor.
Yep, I was waiting to zip in and say, if you take these for a short period of time and you continue to have symptoms, you've got to get checked out.
Read the label, do what it says.
Our thing used to be we would give it for people for 6 weeks, and if they still had symptoms, they had to get scoped. Now people take these things for years.
Years and
they
years
don't
and
tell
years.
their primary care that they're taking them because they're not prescription drugs. It's something I bought, at Walmart, and they forget or they just neglect to tell their primary care that they're taking those.
Yeah.
And so it's not on their med profile.
Yeah.
So they think they're fine.
And if what you're taking over the counter is not working and you are taking a proton pump inhibitor, you need to go see your doctor because you can get a stronger dose of that.
And if it is working, you need to tell them that you're taking it. When you go to see your primary care, you got to tell them every single thing that you're taking, including supplements, because sometimes, like, do any of your supplements or your traditional Chinese medications interfere with regular medications?
Oh, they can, sure can.
Yeah,
absolutely.
yeah.
Yes,
Give us an
yes,
example
absolutely.
of that.
Well, they've shown turmeric, curcumin, is a little bit of a blood thinner. So if somebody's going in for a spinal, like an epidural, pardon me, or a surgery, I'll have them stop that before.
Yeah.
Just like you would an aspirin.
Yeah, they're
or
real.
anti-inflammatory.
They've got real physiologic effects.
Yep.
So tell them everything.
Yeah,
All right.
sure. Hey, and I've got Diesel Child's got a good question that kind of parlays onto this subject.
Okay.
If you're ready for one.
Sure.
He's just asking about his supplements. And the reason this does matter is because he's taken some astragalus, blackcurrant oil, and some other vitamins that Dr. Steve talked about for neuropathy. And he's wondering, does it matter if you take them at certain times of the day or evening? Does it matter? Just like we were talking about with regular prescription medications.
Right.
And the answer is yes.
Well, okay.
In some cases,
some of yours, maybe.
Yeah, certainly.
Now, it depends, like the alpha lipoic acid and those things for neuropathy. I've not seen any data that shows it matters when you take it.
Yeah.
The reason that you have to watch it for certain things is some medications are affected by food in the stomach.
Yes.
And they won't absorb.
Like the thyroid medicine.
Okay.
Yeah.
And some
Yes,
antibiotics and stuff like that.
Yep.
So you if it says take it with food or take it in the absence of food, pay attention to that because that actually matters.
Right.
Now, the other thing is you want to take your medications if there isn't any caveat against taking it with food or taking it at a certain time of day, you pretty much can take it anytime you want, with or without regard to food. But you want to take it at a time when you know you're going to, by God, actually take it. And my thing is, if I have to take a twice-a-day drug, I'm probably not going to take it. I take all my medicines at night, everything, my supplements, everything. I've got it once a day. I can do, and I can be consistent with it.
And that's funny. I'm the exact opposite. I do all mine 100% in the morning.
Yeah, well, there you go. It's
just all do it.
And
just
see,
so
it doesn't matter.
It's
just do it the way that it's going to work for you. And I finally got one of those damn organizers because I got sick of opening up each bottle each night.
Oh, yeah.
And I take way more supplements than I take actual medication.
Oh, me too. Yeah.
And so I put them all in one of those organizers and just plop it out in my hand and do it all in one fell swoop. So anyway, all right, very good.
Did we answer that question?
Who knows?
Solidly? Okay.
How are you?
Good. How are you?
I'm good. Thank you.
Oh, I'm glad.
I have a medical question for you.
Okay.
Since all experts agree that laughter is the best medicine, would you be able to write a prescription so that my patients, can send my Patreon bills through their insurance. Patreon.com/Cardiff Electric.
Very good.
Thank you.
I'm in favor of that. I do think laughter is the best medicine. It certainly helped me with my depression in the past. And, you know, you ever heard of Norman Cousins? He was a journalist, and he wrote a book called Anatomy of an Illness. And what this deal was I think Norman Cousins had ankylosing spondylitis.
Okay, gotcha.
You want to tell people what that's?
Well, ankylosing is an arthritic condition where a lot of the bones in your spinal column and your ribs and even your sternum will fuse together.
Yes, that's
and they become
exactly right.
one big hard bone.
Just you give yourself a bell. People
Thank
can
you.
get sick of me playing it,
Bell.
but that's exactly true.
No, you have to play it.
Okay.
I'm still
all right.
losing.
Give thyself a bell.
Yes, thank you, Dr. Steve. Thank you.
All right. And so he couldn't sleep. And so what he started doing was watching 10-minute intervals of things like the Marx Brothers and things that he found funny.
Okay.
And he said that laughing for 10 minutes would let him sleep for 2 hours at a time.
Even with that terrible pain.
Even with the terrible pain,
Yeah.
As early as the 13th century, doctors used laughter to relieve pain during surgery. I'd like to see. Well, we're going to do trephination now. And by the way, you know, knock, knock.
Yes.
Trephination, by the way, is where they would relieve migraines by knocking a hole in your head with an axe. Yes. So it's very delightful. Let's see.
Hey, try not to move. Try to hold still.
Right.
We don't want to miss.
Anyway. Yeah. And then, you know, at pediatric hospitals, they've got people running around doing jokes and stuff. And when I do living wills with patients and stuff, medical advanced care plans. And a lot of times they dread it because they think it's going to be morbid and we're going to be talking about death and dying. All of my patients leave laughing at some point, and then they'll go, wow, this was way better than I thought it was.
Yep.
You know, and so it goes by faster. Try to lighten it up. It's not like I'm, you know, making stupid gallows jokes. It's just trying to be naturally like we are with everybody, just joking and making it a little bit more lighthearted because it actually is just to just normalize it. And I think that works in medicine. Most of my patients appreciate the fact that, you know, I'll goof around, but I'm serious when I need to be serious. Sure. But we'll goof around a little bit too.
And if nobody's ever seen it, there's some great YouTube videos, laughing yoga classes.
Oh, really?
For people who really don't feel well, there's actually laughing yoga classes, and I'm pretty sure it's
laughing yoga.
Laughing yoga. It's almost impossible to watch it and not start laughing.
Really?
Yeah.
Well, you know, laughter does have physiologic effects.
Sure.
And one of the things is it lowers cortisol levels. And cortisol is a stress hormone, so lowering it decreases your body's blood pressure, and if you do it long enough, it can decrease fat in your abdomen and stuff like that. I'm not saying laugh to lose weight, but you know, there is some evidence that laughter strengthens your immune system because it increases the production of antibodies in saliva. You know, and that's pretty interesting. Yeah, pretty interesting.
Yeah, every little bit helps, Dr. Steve.
So very good. Tried to derail my show, Mr. Cardiff.
Good luck.
But
the laugh is on you.
Yeah, the laugh is on you
because
I turned it into a serious answer.
That's right.
Wait a minute. That's okay. I fucked up. Okay, here we go.
Dr. Steve, I have a COVID-related question for you.
Okay.
My wife tested positive for COVID.
Okay.
We're doing our best to quarantine from one another.
Yes.
But she's craving some personal contact.
Okay.
So, can she give me COVID from a blowjob?
Oh, she's craving personal contact.
Mm-hmm.
Hey, Tacey, have you ever craved personal contact so much that you wanted?
No, sir, I have not.
Wait to give a guy a blowjob?
No, I have not. But you know, we're all different.
Yeah, okay, so yeah, I guess maybe it's possible that she's really craving to give him a blowjob. But the only thing we can do is give you the new updated rules because I'm not going to say yay or nay to this other than quoting the rules. Because if I do anything else, then we're going to get deplatformed. And really, I could give bad advice either way, and then have there be a problem. So, if you test positive, you have to follow isolation recommendations, and you can see this at cdc.gov/coronavirus. So day 1 is the first full day after you had symptoms, if you had symptoms. Otherwise, day 1 is the first day following the day you were tested. So day 0 would be the day you tested positive. Well, I'm sorry, that you were tested, and then if you tested positive 3 days later, like if you did it at CVS, you get the result 3 days later. Day 0 is still the day that you got tested. Okay? Does that make sense? Am I making sense? You go through the line at CVS on Monday. You get tested. You don't get the results back till Thursday. Day 0 is still the day that you got tested, not the day that you got the test back. But if you have home test and you test positive, it's pretty easy. So day 0 is the day you were tested if you took the home test, and or any day that you take any test. And then if you have symptoms, day 0 is the day of symptom onset. Okay. So either the day you got tested or the day you had symptoms. So let's say you had symptoms on Monday, but you don't test yourself till Wednesday, and then you're positive. Day 0 is still Monday. Okay. Now, if you test positive for COVID, stay home for 5 days and isolate from others in your home. We did that I put up a barrier in our guest room, and I had a bathroom, and I had
you had access to the studio,
and I had access to the studio as well, and so that was great. And then you're likely most infectious during those 5 days, so if you have to be around others, wear a high quality mask. Don't go to places where you're unable to wear a mask, and don't travel. I mean, come on. Stay home, separate from others as much as possible. If you can, use a separate bathroom, and don't share personal household items like towels and utensils. Okay. Now, monitor yourself. Make sure you're not getting sick, because then you got to go to the hospital. Now, you can end your isolation. If you had no symptoms, you end isolation after day 5. If you had symptoms and your symptoms are improving, you end isolation after day 5 if you're fever-free for 24 hours. Okay? Now, if they're not improving, you got to continue to isolate until that is true, when you're fever-free for 24 hours and your symptoms are improving. Okay? And then if you had moderate illness, you ended up, probably going to the hospital. You got to isolate through day 10, and they'll tell you that at the hospital. So, okay. All right. So there you go. And you notice that blowjob isn't in that equation.
No, it's not anywhere. No.
So that's the best I can tell you, dude. You guys got to do what you got. I'm just telling you what the CDC says. All right. Here's an interesting one. I think we've got time for this. Oh, well, let's do this one first. This one's important.
I was just calling to say I really like Stacy DeLoach, and I'd like them to keep on calling. I was just calling several weeks ago and said they're not Stacy DeLoach, but I like them. I'm going to keep on calling, have them on the show for more, and punch you know.
Well, there you go.
There you go.
There you go. Stacy. He always says that we always just only play the bad calls that don't like him. I will play 100%. I have played 100% of the calls that called people saying that they like him.
Every single one.
Every single one. Every single one.
That's right. Every single one. Way to go, Stacey.
There you go. But we like Stacey. He's forgiven.
We love Stacey.
Was very naughty, and he has paid his penance.
But he brings treats, so it's okay.
Yes, and he does. He's a good boy. So, all right.
Hey, Dr. Steve, Rob from Akron, Ohio, once again.
Hey, Rob.
I got a question. I was traveling this week, and oddly enough, I met 2 individuals who claimed their wives had gotten cancer, breast cancer specifically, and then instead of going to chemo, they chose to go with control.
Did he say they died?
No, they got breast
cancer. Okay. Oh, sure.
Breast cancer specifically. Wait. Oddly enough, I met 2 individuals who claimed their wives had gotten cancer, breast cancer specifically, and then instead of going to chemo, they chose to go with controlling with diet. Okay. And if they're healthy and they're in remission, that's great.
Oh, okay.
Which got me to think, like, is there odds of someone being diagnosed with, say, a breast cancer, and then not doing any treatment or changing their lifestyle and recovering? Because there seems to be a causal. If they're obviously they're better, I'm happy for them.
Yeah, me
but
too.
was that something that could have happened without the changes in diet?
Oh, no.
Also, is there any evidence that diet changes, like reducing the sugars and things like that, is there any study that shows it, I guess, as a positive outcome that actually makes it meaningful?
Yeah. Okay. So we got to be, first off, there's lots of data that shows that Western medical approach to cancer care, although it can suck, has a decent, and particularly the earlier you catch it,
Yes.
decent track record at producing cures if you catch it early.
Yep.
We're working on what happens if you catch it late
Mhm.
with this CAR T-cell therapy and stuff like that. But let's just talk about catching it early. What I am concerned about, when I hear these stories, is people go, well, I feel better.
Mm-hmm.
And they probably do feel better if they're eating better and all that kind of stuff. But is the cancer smoldering and they're not aware of it? Are they keeping up with surveillance?
Mm-hmm.
So listen, it's a free country. You do whatever you want to do. There can be consequences both ways.
Mm-hmm.
If you don't do well, or if you've got a genetic predisposition to doing poorly with things like 5-fluorouracil and things like that.
Medication, sure.
Then you wish that you'd never seen the chemotherapy suite.
Right.
But those people are few and far between. It's so rare that I've only seen that twice in my career.
Mm-hmm.
But it's free country, just as long as you know the risk, benefits, and alternatives and know what the odds are.
Mm-hmm.
So now, let's talk about how you can improve things if you get cancer by doing some lifestyle things and standard treatment too. And again, prevention is the key, and catching things early is the key.
Yes.
So if you're a woman, examine your breast, get your pap smears done. If you're 45, get your colonoscopy done. We're going to be talking about Tacey's colonoscopy next week. And, those kinds of things. So, okay, that out of the way. Dietary saturated fat from high-fat dairy products is associated with increased breast cancer mortality. So if you want to decrease your odds of mortality from breast cancer, avoiding those things may be the way to go.
Right.
Soy products have not been found to increase breast cancer recurrence and may actually reduce it. People are worried about soy because
I've heard that.
It has estrogen in it. That's not true.
Right.
They have soy isoflavones, which have some estrogen-like activity, but they're not estrogen. And actually, the studies that I've looked at show that those things do not increase your risk, and again, may actually decrease your risk of recurrence if you've had like stage 2 breast cancer, gone through the Red Devil treatment and lumpectomy or mastectomy, whatever you had. And then did surveillance after that. So soy products probably, are beneficial. Western style diets high in processed grains, processed meats, and red meat. And prudent diets, that's high in fruits, vegetables, whole grains, and chicken, had similar rates of breast cancer recurrence. So you really just switching to a more what quote unquote healthy diet may not be enough to do it, but avoiding dietary saturated fat, which sucks because that one of those is butter, and increasing soy products may be helpful. Physical activity can reduce breast cancer mortality by about 40% and has the most powerful effect of any lifestyle factor on breast cancer outcomes. Tacey's the strongest woman I've ever met. If breast cancer, comes within 10 feet of her, it might as well just run.
Yep.
She's
We'll knock it out.
She's going to beat its ass.
And they'll knock it out.
Now, they do recommend
I
150
hope so.
minutes a week of physical activity. And less than 13% of patients with breast cancer actually get that far. And weight management. So patients who are obese or overweight at breast cancer diagnosis have a poorer prognosis. There are some cancers that being overweight is actually
beneficial.
Beneficial. They live longer.
Okay.
It is possible for patients to attain meaningful weight loss, but there's few data on whether this actually improves breast cancer outcomes. So if you're already heavy when you get the breast cancer, there's not data showing that if you then turn around and lose the weight, that's going to fix things.
Gotcha.
Now, they do know that weight gain during or after breast cancer treatment increases the risk of recurrence, reduces survival, and that is irrespective of baseline body mass index. So if you get breast cancer, one thing you really don't want to do is go, well, hell, I can just, I'm just going to
smoke it up,
yeah,
eat it up,
eat it up,
drink it up.
Yeah, do what you can to not gain weight.
Right.
You don't want to lose a lot of weight either, so it is kind of a fine line, but that's an interesting study. So, and anyway, obviously smoking sucks, and if you smoke, you're more likely to have reduced long-term prognosis with breast cancer. And those who quit smoking after a diagnosis have higher overall survival. So if you smoke and you get breast cancer, we've talked about some things you can do. A big one is quit smoking. So exercise. Quit smoking. All you have, check your stupid nuts for lumps doesn't apply, but all the things that we talked about, get off your ass and get some exercise. And we'll see you in 1 week for the next edition of Weird Medicine. So all of that makes a big difference. Not a lot of consistent data on alcohol. So, limiting alcohol consumption, however, to one or fewer drinks a day reduces the risk of a second primary breast cancer. Well, you haven't had the first primary. So if, God forbid, if you had a primary breast cancer, then reducing your alcohol consumption to one or fewer drinks a day will reduce the risk. It doesn't make it zero, but reduces the risk of getting a second breast cancer that's independent of the first one. All right. And then moderate increases in dietary vitamin C may reduce breast cancer mortality, but that was a non-randomized trial, so we're looking for randomized data on that. Vitamin E doesn't seem to have any effect. And again, low levels of vitamin D at diagnosis are associated with a greater risk of breast cancer mortality, but this may be a marker rather than a cause, because there isn't any data that shows that if you take vitamin D supplements that it seems to make any difference.
Yeah.
All right. You got anything else?
No.
Right. What are you guys looking at over there?
The end of the show.
Whispering amongst yourselves.
The end of the show.
Did you think we would make it to the end of the show?
you.
How many times did we get interrupted?
I mean, a million.
Yeah. Hopefully it's not too painfully obvious to those listening. Anyway, well, listen, really appreciate everyone at SiriusXM. Thanks to our listeners whose voicemail and topic ideas make this job very easy. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye,
Thanks,
everyone.
See you guys.
All right, let's do... Yeah, have you got any other questions? Because I've got several over here that kind of ended on a, we did all of our questions for this week, which was good. But we've got some left over from last time.
Hey, Dr. Steve.
Hey, Dr. Steve.
It's Jen and Carol.
We're just calling to say I really.
All right. We got one on blood donations, one on fentanyl overdose.
Well, pick one.
Yeah, pick one. Let's do one.
Do we have anything from the fluid family?
Let's see. Diesel Child had another one. I think I answered it. It's about Irish sea moss as a supplement.
Okay. I don't know anything about that. How about Patty had one about her headaches.
Oh, okay. Let's do that one.
I don't think we ever answered that one. Poor old Patty.
Poor Patty.
Oh, let's do that one. Okay, Dr. Scott. Well, it looks like we've got one more in the waiting room. And actually, it's Patty. Let's listen to this one. I don't know if we
Hey,
ever did this.
Dr. Steve. It's Peppermint Patty.
Wait, we did do this
How
one.
are you?
Good. How are you?
Scott, Yo-Yo.
Yo-yo.
Casey, how are you? And P.A. Lydia. If you're
Hello.
there. Hello. I have a question. Pardon me. I've had 2 severe closed-head injuries and
No, I didn't answer
headaches
this
that don't stop
No,
with certain medications. I've been able to manage those. However, I do get from time to time these flashing light, ribbon of light type things that aren't always preceded with a migraine. Often they are, but not always. Here is my question. I looked up to see what this was about, and what I read on Google said that the, I don't know how you say this, so pardon me while I butcher this, the virtuosus gel, sorry,
vitreous.
fails to
Vitreous of the
separate
eye.
clearly. Here's my question, because a lot of people deal with headaches. When do you know, like, okay, not to worry about this, and when do you know to worry about
yes,
it?
excellent question.
Because as someone who suffers from headaches and migraines on a fairly consistent basis, most of them I don't worry about it, but I'm like, when do you worry about it? 'Cause
That's a great question. So, when do you worry about something like this?
I don't know.
So if you've had migraines your whole life and you always get the ocular migraine, which is the flashing sort of marquee lights in the upper outer quadrants of your vision, whether it's associated with a headache or not, sometimes it will be, sometimes it won't be, and it's thought to be decreased blood flow to certain parts of the brain where the visual cortex is understanding signals from the outside.
Okay.
And when you get spasm of these arteries, and then you get dilation of the artery, that's when the artery starts to relax. That's when you get the pounding headache, because the arteries are dilated and the body thinks that they're ripping, even though they're not. And that pulsation that you get from the heartbeat causes a pounding headache, right? But sometimes you just get the ocular flashes, but you don't get any headache with it. And if you've been having those since you were 18, the first time it happened, you probably got checked out.
Yes.
I remember seeing people that were 17, 18 years old that had numbness in their left arm, and that could be associated with migraine as well. And so once they figure it out, well, that's just my migraine, and take their migraine medicine. But if you have something different, where you get a flashing, shooting light in your eye, one side or the other, that can be a sign that the vitreous, which is the gel-like, very clear jelly that's in the eye that transmits light from the outside to the inside to the retina, has pulled away from the retina, and it's actually tearing the retina. If you have that, like lightning flashes, especially when you move your eye a certain direction, that is an emergency. You need to get that checked out. So the big thing is it different? Is it something that you've had checked out before, and now this is different, or is it the first time you ever had it? So we used to talk about sex headaches on this show back when we did interesting questions, and not that Patty's isn't interesting. I don't mean that. I'm talking about in general. People would call in saying, every time I bust a nut, I get this horrendous headache. Well, we're always told when you have the worst headache of your life, you need to get it checked, right? And then after that, if it happens every time you bust a nut and they've told you this is a sex headache, you can ignore it after that to the best of your ability, or take the medication that you're supposed to take to prevent it. So same thing with blood in the stool. If you see blood in your stool, the Dr. Steve's rule of blood in the stool is the first time that you see it, you got to get it checked out.
Check it out.
It's the first time you have blood in your semen, get it checked out. The first time you have a bloody nose as an adult, get it checked out. Make sure that it isn't anything more serious. And then once they tell you, no, it's your hemorrhoid, or it's totally benign, and then you've hit somebody's car and the cops come after you, or you, have whatever, test and they say it's completely benign, you don't have to worry about it, then you can ignore it. So that's the answer.
Yep.
Is if you don't recognize this symptom and it's something weird like that, get it checked out. And if it's something you've had over and over again and you feel pretty confident that's what it is, then you can ignore it if you've been told that you can ignore it. Okay?
Mm-hmm.
All right.
All right.
Anything else?
No.
Excellent question, Patty. Sorry it took so long for us to get to it. Thanks to everyone at in our shit. Fuck, I was reading the wrong one. Hang on. Almost done. Thanks. Always go to Dr. Scott and Tacey. Thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. And listen to Jen and Carol on Mom Swipes Left. And until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye, everyone.
Bye, Holly.
See you guys.
Bye, Steve. We'll see you in a couple weeks. All right, very good. Now let's do the beginning and we'll be done. Oh, boy. Did I just record over... Okay.
Are we fucked?
Yeah, we're a little bit fucked. We're going to have to do that all over again. I'm so sorry. It's just late and my medicine is wearing off.
Steve's niece sent me that.
Hang on.
Dog
I need
turd.
to make sure that I don't fuck up even worse.
No, they'll do it. That's beautiful.
Hang on. Oh. Oh, wait. No, we're okay. We're okay.
Cool, buddy.
Okay. Shoo. All right. Hang on. Hang on. Oh, boy, did I luck out on that one. Okay, now we're good. Whew. Okay, all right.
Holy
Ready?
Shnikes.
What's wrong?
No, we're good.
Okay, yeah. I'm not as dumb as I thought I was.
So you're going to Nash Vegas?
Nash Vegas, baby.
What are you going there for?
Tedeschi Trucks Band.
What happened to the cat that ate a ball of yarn? They had mittens. And if you're heading out, why did the dust bunny fall in love with a Roomba? It was swept off its feet. What do you call a pile of kittens? A meow 10.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine practitioner who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Please don't forget to check out stuff.drsteve.com, stuff.drsteve.com for all of your shopping needs. Just click through, go to Amazon. It really helps keep us on the air. And Dr. Scott's website, it's simplyherbals.net, which we'll talk about in a second. And then patreon.com/weirdmedicine. That's Tacey and me. And we do the exam room where we have celebrities ask us questions, or we answer your questions. 100% of questions that are called to Patreon get answered. So patreon.com/weirdmedicine. And then if you want me to say fluid to your mama, just call click on cameo.com/weirdmedicine. It's dirt cheap. It's fun. I really enjoy doing it. So I'll drop the price even further if I have to. I just hate for people to look at it and go, wow, that guy really, he's got nothing going on. $9 bad enough. But anyway, all right. You ready?
Ready.
Ready.
Wrap it up.
No, Scott, we're starting the show, remember?
Mhm.
Okay. All right. We're done. Finally.
Leave it on?
Yeah, leave it on. We'll
We'll play. Hey, we need to do your commercial if you want to do it today.
Yeah, not today. Not
Not
today.
today.
We'll do it next Tuesday.
All
Next
right.
Saturday, yeah.
Okay.
We will get it done.
We're gone spring break, so get it done.
Yes.
Get her done.
Get it done, baby.
Yeah, so the Saturday after, we're still here, right? So we're going to need
It's
to
the
get it.
18th of March. I mean, it's coming.
Yeah.
We should have one more Saturday before.
Beware the 18th of March. I need to clean up there before I do that. All right, what are we playing, my brother?
Let's do that. Let's try the Atlantic City again.
Atlantic City?
By the band. Clinton sent me a
Oh, yeah. He said he
intro.
was going to do that.
Yeah, I didn't quite get to practice it.
Is he listening?
Yeah, he's on there.
Hey, Clint.
He's on there.
The Clintoris. We named one of our episodes after him.
That's it right there.
Cool.
A little kickoff, yep.
Don't remember. I saw the band live twice, once in their glory and once in their waning days.
Not so glorious.
But the glory one was I saw them with Bob Dylan. It was Bob Dylan and the band at Charlotte Coliseum. It was pretty amazing. Wow. Listen to that. Wow. Since when? What the hell happened there?
I took my astragalus this morning.
Well, I took
not enough astragalus. We got to get you some more.
50 milligrams of modafinil. Listen, my problem is I either take too much of that stuff, and then I'm crabby all day, or I don't take enough, and then I'm tired. So I didn't fall asleep on the way home.
We should have had Sean send you home with some goodies, but I guess he's out. He's watching What's His Face today.
What are you talking about?
Sean is watching some comedian tonight.
Oh, Jim Norton.
Norton, yeah, okay, that's what it is. Yep. All right, here we go.
Hang on, I gotta
see if you
check
got
with that lady.
See if you got the levels right on this.
Please tell me you got it on time. Period. Okay.
Just about, baby. Let's do it. So let's see if we can do this. Yeah. So, ready?
Oh yeah. Wait. Let's give you. Wait.
Yeah, just make sure we
I'm
get.
not ready. I'm not ready.
Give me a little reverb.
Okay, we got the far. That's.
Well, they blew off the chicken man in Philly last night. They blew up his house too. Down on the boardwalk, they're heading for a fight. Gonna see what them record boys can do. Now there's trouble bruising from out of state, and the DA can't get no relief. Gonna be a rumble out on the promenade, and the gambling commissioners hang on by the skin of his teeth. Everything dies, baby, that's a fact. And everything that dies someday comes back. Put your makeup on, fix your hair up pretty. Meet me tonight in Atlantic City. Well, I got a job and put my money away, but I got a kind of the debt no honest man can pay. So I drew what I had from the Central Trust, and I bought 2 tickets on that Coast City bus. Everything dies, baby, that's a fact. And everything that dies someday comes back. Put your makeup on, put your hair up pretty. Meet me tonight in Atlantic City. See, now your luck has died and your love may be cold, but you will reveal, I say. You're going out where the sands turn to gold, so put your stockings on, 'cause it might get cold. Everything dies, baby, that's a fact. And everything that dies someday comes back. Put your makeup on, fix your hair up pretty. Meet me tonight in Atlantic City. Now I've been working a job, but it's hard to find. There's winners and losers, and I'm south of that line. Well, I'm tired of coming out on that losing end, but I talked to him and that's not gonna do it a favor for him. Everything dies, baby, that's a fact. And everything that dies someday come back. Put your makeup on, fix your hair up pretty. Meet me tonight in Atlantic City. Meet me tonight in Atlantic City. Good job. Well, Clint, I tried to kick off. I think I got it close. I got it close. After not practicing.
I probably need to listen to it. I have no idea what.
That sounds pretty close. Oh, Clint's seen TTB 4 times. Hey, buddy, I've seen him about 50. I love him. That's such a great tune. You have time for one more?
All right.
I like
I'll
it.
play. Yeah,
I like it.
What do you want to play?
I was looking to find something else we could do that would be a nice little. Oh, you know what we hadn't done forever is Bertha, or we could do From the Dead.
What?
We haven't done Bertha from the Dead in a while. We haven't
Bertha?
done Bertha. Bertha, don't you come around here anymore? We could do.
Okay.
Let's.
What about Series of Dreams?
Ooh, Series of Dreams. We haven't done that forever either, have we? Anybody got anything interesting out there? Oh, Deal. Well, we could do Deals.
What is
Dirty Flowers. We could do Deal.
Deal?
Deal, yeah, waiting for that deal to go down by the Grateful Dead. Let's see. Deal.
Let's see if I can find it.
We should have.
Oh well, I put it in Grateful Dead. That probably
Grateful.
No. Oh, here we go. Yeah, I found it.
We could do since it gets to cost a lot to win and even more to lose.
What song is that? Deal?
Yeah, you mean better spend some time. Oh, I don't like it. Not in G anyway.
Okay, give me another key.
Ooh, sweet mother. That was painful. I don't think I can get up there that high this late. How about in D? D should be D, F sharp. Since it costs a lot to win, even more to lose, you and me better spend some time wondering what to choose. Goes to show you don't ever know what cheats card you're playing down and slow. Wait until that deal goes down. There you go. Don't you let that deal go down. No, no. I've been gambling hero bouts for 10 good solid years. If I told you all that I've done, I would burn off both your ears. Goes to show you don't ever know what cheats card you're playing. Play it slow. Wait until that deal goes down. Don't you let that deal go down. No, no. Hey, hang on. Pause it for just a second.
Yeah?
The boss is calling.
Oh.
She never calls. Uh-oh. Yeah, that. Hey, honey, what's good? Yeah. We're just gonna wrap it up. Okay, Pumpkin. I'll call you in just a second. Honey, bye. Sorry about that. All right. Oh yeah. Let's do one more. Let's do that one more time. Yeah, love it. She's like, yeah, that's a much better key for Dr. Scott. Well, ain't that true? Yeah, what we'll do? Let's do that. Let's do Deal, and then next time we'll play for her. We'll play Sitting Here in Limbo. Is that cool?
Yeah.
So let's do Deal.
Okay, I'm ready.
And we'll get a 3, 2, 1, and since it costs a lot to win and even more to lose, you and me better spend some time wondering what to choose. Goes to show you don't ever know
I've been gambling here about for 10 good solid years. If I told you all that went down, it would burn off both your ribs. Goes to show you don't ever know what cheats card you're playing. Play it slow. Wait until that deal goes round. Don't you let that deal go down. No, no. Well, since you pulled the wine for me and tightened up my shoes, I hate to leave you sitting there with those lonesome blues. Goes to show you don't ever know what cheats card you're playing. Playing slow. Wait until that deal goes down. Don't you let that deal go down. Wait until that deal comes round. Don't you let that deal go down. Wait until that deal comes round. Don't you let that deal go down. Don't you let that deal go down. Don't you let that deal go down. Oh, no.
That was it?
That was it, yeah.
Okay, God.
I was going to play the break.
Well, I got to really, this is a key I'm not used to walking in, so.
Yeah, that was I could have played something else, but hell, I couldn't play the friggin' we could have done an
Oh, well, anyway. I'll work on
Cool,
that
man.
one.
Yeah, cool. All right, guys.
I just got to remember it in that key.
Yeah, that's all about. Guys, hate to run, but I got to go. The puppies are calling. The puppies are calling.
All right, anyway. Well, that sucked. Sorry,
Thank you,
everybody.
guys.
Sorry I fucked everything
No,
up.
it was good. That was good. That was good.
All right. Ah,
Yes,
oh.
love it. If we do Shakedown Street Dale, we'll take some practice. Dr. Steve could use a wah-wah pedal.
I have one.
Oh, well, yes, so we do. We'll have to practice that, boys and girls, ladies and gentlemen. Thank you all. We'll see you in about 10 days, I guess. Yeah.
All right. Yeah, well, that's right. Tacey and I will be doing a Patreon pretty soon.
This weekend. Oh, cool. That'd be cool.
Thanks, everybody.
Hey, we do appreciate y'all. Have a good evening.
Really do.
Take
Thank
care.
you.
We do appreciate you.